Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we'll learn valuable back-to-school tips with Dr. Stephanie Connell of Novant Health Family and Internal Medicine, South Brunswick. Then Dr. Joseph Misk of Novant Health's anesthesia team will join us to share information about safety and advances in anesthesia. And finally, Sheila Roberts of Brunswick County's New Hope Clinic will share information about the clinic's services as well as an upcoming fundraising event hosted by the clinic. Stay tuned to learn about valuable health topics with HealthWatch. First, we'll welcome Dr. Stephanie Connell of Novant Health Family and Internal Medicine, South Brunswick. Dr. Connell, welcome to the show today. It's a pleasure to have you back.
Thank you. It's wonderful to be back. I appreciate it.
It's been a while.
It has. It's been almost a year now.
I know, and I hope it's been a great year for you.
It has. I love the community. I love all the water sports that we're able to do, and I just loved being a part of the practice. So it's been a really good year.
Well, awesome. Thanks for saying that. So let's start by reminding our viewers about your background and your schooling, things like that, okay?
So originally from Oklahoma City, Oklahoma, born and raised. I did my undergraduate at the University of Oklahoma, and I received my degree in zoology and biomedical sciences. I then completed medical school at the University of Oklahoma College of Medicine, and then did my family medicine residency in Greenwood, South Carolina through the Self-Regional Family Medicine program there.
Wow. How long were you in South Carolina?
So 3 years. It was my first time being in the area, and I loved it. It was a great experience.
Oh, wow.
It's kind of how I ended up staying in the South over here, too.
Mm-hmm. So did you join Novant Health straight out of residency?
Yes. So I was really lucky to be able to start working for them. I had about 6 weeks off in between that.
Nice.
And it was a really great transition from going from residency where I taught and interacted with a lot of children and patients of all ages. It was really nice to have a clinic opportunity to be able to still see children and adults also.
Wow, that's great. Well, now I know that you're at Novant Health Family and Internal Medicine in South Brunswick. And tell our viewers where that's located.
So that's at 75 Emerson Bay in Suite 102. It's right off of Highway 17 and Emerson Bay Road and kind of quarters along with Persimmon Road also.
Oh yes, Persimmon. You can go onto Persimmon and then turn right into the practice there. And that's a great spot. I mean, it's very visible. Parking is great. The imaging center is right next door. That works out well.
Yeah, I was really fortunate. That was actually one of the big reasons why I wanted to join that practice was you have on-site x-ray that you're able to do. Also, they can do ultrasounds in there, which is great for any of our patients. If we're worried about a blood clot, if we're worried about a fracture, we can just get them right next door, have those done immediately, and let them know the peace of mind everything's okay, or this is what we found, this is our next step in treatment.
Yeah.
It's been really nice, too, that we also have the on-site lab draw, so we can do all of our labs on-site. It's really convenient for our patients to be able to come and have them done before their appointment so that we can talk about them at their appointment. And then also the same thing, if we need something done, if we're worried about a bladder infection, our patients don't have to drive anywhere. We can get all that done on site.
Yeah, it is. It's so convenient for the patient, so that makes it nice. Let's talk a little bit about the other providers in your practice.
So we have 3 medical doctors. That includes me. We also have Dr. George Bell, who is board certified in internal medicine. Dr. Candace Sieben, who is also a family medicine physician. We actually have the physician assistant providers from Seaside Family Medicine that will be joining our practice also, Hillary and Adam Thompson. They also treat children, so they're involved in the family medicine aspect, which is a really nice addition for us. We also have nurse practitioner Vanessa Norton, and then we just had endocrinologist Dr. Whiteside actually join our clinic this June, and nurse practitioner Virginia Zimmer will be working with him also. We've really been lucky to also have the specialists that come and rotate through our clinic on different days of the week.
Yeah.
So we have general surgery, urology, and OBGYN that all alternate days at our clinic, and that's been really nice to have our patients have that close access instead of having to go over to Bolivia in the hospital and be seen by them at our clinic. And it's nice for us to be able to interact with them
Yeah, that's
also.
what I was thinking. Yeah, it's nice to have the interactions between the family practice and the specialists.
And it makes sure that we're really addressing all of our patient needs. So it's been really nice to have them, and they've all been incredibly wonderful and welcoming.
Well, nice. That sounds great. It sounds like a full house.
Yes, it is. And we're growing, but it's a good growing.
So I know that you're a board certified family physician. So again, that does mean that you see all ages. I guess you would see the babies up to the grandmothers. Is that correct?
So everything in between that. So part of family medicine residency is that you get to have a little bit of everything and get to see that family dynamic. So family medicine residency, we cared for women during their pregnancy. We were involved in the delivery, and then we saw them through their entire aspect of life. And then it is really nice to be able to see entire families, and that's something that Dr. Sieben and I really enjoy doing, and that also Hillary and Adam Thompson like too, is having to be able to treat the whole family and be involved with them on that personal and medical level also.
How young of a patient will you see?
So we had been transitioning from being internal medicine only in 18 and up to we had been seeing just ages 2 and up, but now we're going to start seeing all ages.
All ages, so a newborn.
Yep, so first right out of the life, we're ready to see them.
Well, that's great. I hear that you have a special interest in children's health. Is that correct?
I do, and a lot of that stemmed even before medical school. I was a swim instructor, and I love just interacting with the little kids and teaching them and helping them to grow and encouraging them. And that was something I really knew in medical school I wanted to continue in my professional career. So I love interacting with children, and it's great that family medicine allows me to do that also.
Well, that's awesome. That's awesome. Well, the timing for that topic is perfect because I wanted to talk about back to school and injections and their immunizations and things like that. So let's talk a little bit about what a parent could expect if they have a kindergartner ready to start. What should they do? How do they prepare?
Big thing is making sure they're keeping up with their yearly physicals with their medical doctor. So as all the parents out there know, once your child is born, you're going to be seeing your doctor about every 2 to 4 months, going through the developmental stages, making sure they have all the right vaccines, up until about 2 years old. After that, we do still want to see them every year to make sure we're keeping up with their vaccines. It is important in the North Carolina system to have the vaccinations needed because that is a requirement for children to continue their education and to remain in school. The biggest ones that I see that parents may have missed or gotten off on are obviously the varicella with the chickenpox protection with that too, and then the measles, mumps, and rubella. Both of those are really important to make sure that they've gotten, and so I really encourage parents to make sure if they're not sure their kid has had the vaccinations they need, call their physician, get in to see them, and make sure that they do have the immunizations that they need. If not, they have up to 30 calendar days, or the child will be asked then to remain out of school. Now, for parents that do not feel that the vaccinations are the best decision for their family, or if they have certain medical illnesses that would actually be exempt from having certain vaccinations, there is a form that parents would need to fill out that's available through the North Carolina website. Your family physician would also have access to that, or your pediatrician, and the school systems have that also. That would be important to fill out too, and make sure that so your child is not asked to be kept out of school. If they haven't had their vaccinations and there is an outbreak for something they haven't been vaccinated against, your child may be asked to stay out of school though until they've been able to handle that outbreak so that your child's not affected by that, which could mean weeks to months depending on the disease process.
And I assume that the same is true for older children. They need to have yearly physicals and so forth to just to remain healthy.
Same exact thing. The big things for them will be the tetanus and the whooping cough protection, Menactra, and then the Gardasil for the HPV protections will be important for them also.
Yeah, that is a good one. I hear a lot about that. It gets a lot of airtime on TV. So, well, I think that your practice is definitely convenient. It's like a one-stop shop. The whole family can go. It makes it easier for appointments and what have you. So I think that's a great way to go with families with children. Makes
Perfect. We're hoping to keep expanding our practice. We'd love to see more patients of all ages, and just let us know if they need anything.
Great. Well, it's been a pleasure to have you back today. Our time has expired, and maybe we can have you back again real soon to talk about some other things with the children. And
I would absolutely love that. Just let me know.
okay, great. Thanks again.
Thank you.
Our next guest is Dr. Joseph Mishk, an anesthesiologist with Novant Health Brunswick Medical Center. Dr. Mishk, welcome to the show today.
Thank you.
Great to have you here. And I know that some of our viewers out there probably would like to know a little bit more about you. So let's start by talking about your experiences and a little bit about your background.
Okay. Well, I grew up in Birmingham, Alabama. Managed to escape and get up to Philadelphia for all of my secondary education. So sorry to my UNC fans, but I went to Villanova for undergraduate, stayed up there for medical school, residency, and then worked actually in downtown Philadelphia for 6 more years before I came down here in 2010. Been down here for the last 7 years. Don't foresee myself going anywhere else in the near future.
No, that's great. It is lovely here. It's just a great place to live. And I understand that you're an anesthesiologist with Providence Anesthesiology Associates. Is that correct? That is a mouthful, Joey.
It is a mouthful. We like to abbreviate it PAA. It's a lot more simpler.
So well, from here on out, it will be PAA. Yeah. So tell me a little bit more about the group.
We're a physician-owned and run group of about 70 anesthesiologists across Virginia, North Carolina, and South Carolina. We have a partnership with most of the Novant facilities. So the group itself is actually based out of Charlotte, but we have docs all across the state and been a part of them for about the last 4 years.
But that doesn't mean that you guys travel to all the hospitals. You're primarily based here.
Correct. No, my home base is the Coastal Division,
right.
But we're just part of the large group that is associated across the Novant facilities.
Right, yeah. So your group provides all the anesthesia services then to Novant Health Brunswick Medical Center, correct?
Correct. There are 4 doctors stationed down here at the Coastal Division down in Brunswick. We're all members of the PAA group, or Providence Anesthesia Associates. But we provide all the services from surgeries, epidurals, any other procedures that may need to be performed at Brunswick.
Well, our goal today is to help our viewers learn a little bit more about anesthesia and the many advances that I'm sure have been made in the last several years. So let's start with the most basic question, which is, what exactly is anesthesia?
Right. It's a very common question that I get from a lot of people. In its simplest form, anesthesia is just the loss of sensation and awareness. People view it as, I'm coming in for surgery, I'm going to go to sleep, but there's a lot more involved to it than just sleep. Kind of the easy way I explain it to people is I have 4 main goals I'm looking for with anesthesia, which would be, analgesia or pain control, unconsciousness, asleep.
Yeah.
It's a good thing. Amnesia, meaning you don't remember what happened.
I like that one. Yeah.
And then relaxation, meaning you'll stay still during surgery. You'll relax. So anesthesia is a combination of any of those 4 things. But to the patient, it's really you go to sleep, you wake up, and it's done. And that's usually all they want to hear is, I'm going to sleep through everything, correct? But it's more than just sleep.
That's what I always say. No, I'm not going to feel anything, and I'm just going to sleep through the whole thing, right?
Everything else I don't want to know, Doc. I want to be asleep.
I don't want to know about that. Well, that's really interesting. Well, let's talk about the different types of anesthesia and under some of the circumstances that they might be used.
So we tend to break anesthesia down into 3 main groups, shall we say. So the old-fashioned, you're completely asleep, you don't remember anything, do anything, we call general anesthesia. Now, general anesthesia just means that you're unconscious and you're out, you don't know what's going on. We can just give you sedation where you may or may not have some fuzzy memory. Or there's also ways, that we can make certain parts of your body turn off and go to sleep. Like epidurals, women having, babies, they're awake, but they're under anesthesia because we've turned off the sensations that they're having. And we call that regional anesthesia. So those are the 3 main types of anesthesia. Now there can be overlap, so just because you're having surgery doesn't mean I'm only getting one of these. You may get all of them. So a lot of people come in for knee replacements.
Right.
We make their knee go to sleep or numb so they don't feel it, but we'll also put them to sleep because they don't want to be awake or helping the surgeon while they're performing the operation.
Oh, I think that'd be kind of cool to watch.
It can happen if that's what you prefer.
Yeah, I don't know. They use hammers and stuff.
Hammers, saws, drills.
Yeah, I don't know that I want to see that. Well, okay, for patients who will have surgery that does require anesthesia, what are the typical steps that the anesthesia team would take? What would we experience?
That's actually one of the newer advances in anesthesia in more recent years. Is something we call the perioperative surgical home. So obviously you visit your surgeon.
Yeah.
They schedule the surgery, and then, you know, what kind of happens, you show up the day of surgery.
Yeah.
So we've kind of taken control over a lot of that preoperative care.
Nice.
You know, as far as preoperative scheduling, visitation, lab work, all that. We found that patients tend to do better. We tend to eliminate or decrease cost. So that's what happens behind the scenes, shall we say, in the days to weeks leading up to your surgery. Obviously, the morning of, you kind of got to come in a little bit grumpy, a little scared. Everybody, nobody gets to eat, nobody gets to drink, so everybody comes in a little grumpy. And just nervous, not knowing what's going to happen the morning of.
Right.
At that point, then we obviously take them into the surgical suite, the operation happens, and then hopefully they wake up quickly, comfortably, and then get to go home, enjoy, you know, shall we say, the rest of their day.
Well, after surgery and after the anesthesia, what might we expect to experience? Would we be sick? Will we wake up fast?
Right.
How do we feel?
In an ideal world, obviously, we'd be able to snap our fingers,
Yeah,
and patients would, you know, be able to wake up and go home. Kind of the old adage is less is more, but sometimes for bigger surgeries, you know, you need a fair amount of medicine to put you to sleep. And there are, I don't want to say risks that are associated with that, but there are side effects of medicines, one of the most common ones being nausea and vomiting. We try and do everything we can to stop that, but we don't always win. The other big thing that you'd expect from anesthesia, not necessarily from the anesthesia itself, is just you're having surgery, so there's going to be some discomfort. Because of that, you'll need pain medicine and some of the lingering effects of the anesthesia and the pain medicine that, you know, has the benefit of leaving you a little bit groggy and sleepy, but also leaves you a little bit groggy and sleepy, so you don't bounce or snap right back.
How about risks? Talk to me a little bit about risks of anesthesia.
Well, obviously we already just touched on nausea and vomiting, which is a very common side effect associated with.
I don't think that's so bad.
Right. But obviously the big risk everybody is always afraid of when they come in is, am I going to wake up? Right, and that's the one question we always get. Backtracking, anesthesia, you know, in the 40s, 50s, 60s, when I was a little kid, was the risk of passing away was about 1 in 10,000.
Wow.
To now it's about 1 in 250 to 1 in 1 million.
Wow.
So
huge difference.
And that's taking all comers, obviously, depending on, you know, if you're having heart surgery, brain surgery, your risk factors coming in. But it's a lot safer. What I always tell patients, and usually their spouses, you're a lot safer in my hands than you are riding with your spouse on the way home.
Well, that's great information. And finally, do you have any words of advice for those of us who may be going to have surgery in terms of anesthesia? Any words of advice?
Biggest thing I tell patients when they ask me about anesthesia is, one, follow directions. So when we tell you not to eat or drink, please don't eat or drink anything. But anesthesia is very individualized. We're going to ask you a lot of questions, and feel free to ask us a lot of questions. Because, I mean, everything really is going to be tailor-made for you. And we want to provide the best care possibly for you.
Great. Well, thank you so much for being here today. It's been very informative. We always love to see you, and we hope to see you again real soon.
Well, thank you.
Except, no, I don't want to have surgery. So
that's right.
I'd
See
rather
me here.
you be here.
That's right.
Okay. Thanks, Joe.
Thank you.
Our final guest is Sheila Roberts of New Hope Clinic. Welcome to the show today, Sheila. It's such a pleasure to have you here.
It's wonderful to be here. Thank you for the opportunity.
Well, great. Now, I know we're going to learn a little bit about you and about the clinic, about New Hope Clinic, so I'm really excited about that. But let's start with your role. What is your role at New Hope, and tell me about your background.
Sure. I'm originally from a tiny town in central New York, and I have a bachelor's degree in health and society and a management certificate in public sector analysis from the University of Rochester in New York. I've moved around a bit. My husband was in the military, so I worked in different industries throughout that, had some opportunities. And then in 2008, when he got out of the Navy, we chose the prettiest place with a nuclear power plant. And I became a volunteer at New Hope Clinic. And then in 2009, I was appointed as executive director. So I kind of make sure everything is running, that the clinic is running as efficiently as possible, helping our providers get the care they need, and keep the organization going.
As long as I've known you, I didn't realize you started as a volunteer.
Absolutely.
What did you do?
One afternoon a week. I started out helping with some computer work, turned into 2 afternoons a week, and it grew from there.
Wow, that's amazing. And what a great executive director you are. You've done a fabulous job.
Thank you.
Let's talk a little bit about the clinic's mission. Some of our viewers out there may not be very aware of the New Hope Clinic, so let's share a little bit about their mission and their history. How did it all begin?
Sure. New Hope Clinic is an independent 501c3 charity. It was founded in 1998 to ensure that the low-income uninsured have access to health care. Mm-hmm. It's grown and changed over years quite a bit, but our mission remains the same. Mm-hmm. We're providing medical and dental care, prescription medications, diagnostic testing, and health education to the individuals in Brunswick County who are adults and can't access health care a different way. They're low income mm-hmm. and have no insurance, so they don't qualify for Medicaid or Medicare, can't qualify for those, yet don't earn enough to purchase private health insurance or a doctor's appointment on their own.
Mm-hmm. So they kind of fall through the cracks.
That's it. We're trying to be our community's answer to the gaps in our healthcare system.
Mm-hmm. Yeah. Wow. So what types of patients are primarily served by New Hope Clinic? Are they medically? I mean, is it like diabetes? What kind of things do you see?
We're a lot like a family practice where
Okay.
you get patients with all sorts of medical needs. Many of them do have chronic diseases like diabetes, hypertension, high cholesterol. We can also help perhaps a younger individual who has a periodic infection or some care that they need. We're just trying to make an option for someone who can't get to a regular doctor's office, help them before they get to the emergency room or before the condition becomes too serious. If they might qualify for a different program, we'll help them get connected to that. But we want to get them enrolled in our system so that we can give them an option to be healthier, care for their families. Some of our patients are working, some are not. It could be someone who's had a job their entire life, and then they lose that and they lose the insurance benefits along with it. So we try to help them get through until then. Could be a senior who's on Social Security income, but not old enough to qualify for Medicare yet.
Right.
So we all see all sorts and do what we can to help each one of them. Every case is very different.
So you don't see children, is that correct? It's just adults only?
That's correct. Most children in Brunswick County would qualify for Medicaid or Health Check, Health Choice programs, where their parents or the grandparent caretakers may not qualify for that.
And do the patients only come when they're sick, or do they come just in general?
Just in general, we hope. We want to see them to keep them healthy,
well?
keep them well. Absolutely. A lot of patients will come every 90 days for regular doctor's appointments like a family practice would. Yeah.
Wow. Well, how about payment? Is there a charge?
Every service is provided at our facility is free. Many of the patients will make some contribution as they can, but we don't require it. When services are required beyond what we can do at the clinic, we work with hospitals and private practice doctors to try to arrange something for them for medically necessary care that could either be free or at a reduced cost or set up a payment plan. But we're truly a free clinic.
That's unheard of in these days. Well, you mentioned the providers, the physicians. Tell me a little bit about the doctors that do help out at the clinic and what kind of services do they provide there?
Well, we are a volunteer-driven organization. We have over 150 volunteers every year. Last year they contributed over 11,000 hours of service. Everything from receptionists to dental assistants. We have a small paid staff, including some healthcare professionals, but we have doctors, some from Novant, physician's assistants, nurses who help. They're all fully licensed North Carolina professionals that are credentialed, so it's top quality healthcare that's provided on site. Most of our visits are primary care doctor visits, like a family doctor. We also have some specialists on site. We have an endocrinologist. And then we work with Cape Fear HealthNet to get additional services with private providers, like a gastrointestinal group that has agreed to take a certain number of our patients to help out with medically necessary treatment again. We also have health educators on site. We provide one-on-one diabetes education, as well as we have groups that are available to open to the public. We do one class in Boiling Spring Lakes and one class in Charlotte at the Senior Resources Center.
Wow.
We have a limited dental clinic where we provide urgent care and some restorative and preventive, and we have a licensed pharmacy on site as well.
So you have a pharmacist.
We do have a pharmacist. We have 9 pharmacists who volunteer with us.
Wow.
We can always use more. We also have optometrists, especially for our diabetics. It's important to get their eyes screened every year so we can halt progression of that disease in their eyes.
Wow.
And keep people working. There's a little of everything under our roof.
Well,
we do that at our 2 locations. Our main clinic is in Boiling Spring Lakes, where we're open 5 days per week.
and now you have one in Charlotte,
Yep,
right?
we have a satellite clinic in Charlotte that's co-located with the Brunswick Family Assistance
Nice.
Agency. We have a lot of crossover in needs with the organizations, and that clinic is open limited hours.
Well, I guess with all that free care, we have to get the money somewhere. So tell me about the funds. How do you raise funds for the clinic?
Most of our funding is local. We're truly a community organization. We get funding from private foundations, United Way. A lot of civic groups support us, individual donations, corporate sponsorships, and then we have special events as well.
So I know you've got a special event coming up pretty soon. So tell me about that.
This is a fabulous event for us. It's a partnership with the Southport Rotary Club. They focus on helping the youth and the health needs of our community as well. So they came to us several years ago, and it's called Go Jump in the Lake.
Go jump in the lake.
It's a run walk held on the Saturday of Labor Day weekend in Boiling Spring Lakes. It's a community fun fitness event, but it's also got a little bit of a competitive edge to it.
Right, yeah.
We have a 10K, a 5K, and those are chip timed by Go Time, so a professional timing company. That's what the competitive people are looking for, I think. But you can also walk those, and then we also have a 1.5 mile fun run walk.
Right. Now it's in Boiling Spring Lakes, and what time of the day is it?
It's on that Saturday the 2nd, starting at 8:30 in the morning.
8:30.
That's the first race, and then the others go after that. We'll have some food vendors, food trucks on site, and some activities for kids, so you can bring the whole family out. There's discounts for children to participate, as well as for active duty military, EMS, our public servants, trying to make sure that everyone has an opportunity.
Sure. Well, how can we sign up?
Go online. There's information either from the New Hope Clinic website, Southport Rotary website, or through the timing company Go Time. There's also a Facebook page, or you're welcome to call the clinic for more information.
And what is the number at the clinic?
The phone number is 910-845-5333. That's the phone number you could use for event information, as well as learning about how to be a patient or volunteering.
And so you're always accepting volunteers, correct?
That's right.
So
we do.
we can call, if anybody out there is interested, they can just pick up the phone and call you, and you'll just find a job for them, right?
We do find a job for just about everyone.
Great.
There's also a link to our application and information about the positions on the website for newhopeclinicfree.org if you go to the volunteer section.
Great. Well, I look forward to the race, and I look forward to having you back to see how it went, and we'll learn some more about New Hope Clinic. So thanks so much for being here today.
Thank you so much, June.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.
Time. When things go right, we're where we need to be, when we need to be. But when someone is sick or hurt, time gets away from us. At Novant Health, we know that we need to operate on your schedule. We take the time to give you the care and attention you need and get you back to what matters most. Because your time is everything, and so is she. Novant Health, making healthcare remarkable.
When you build a bundle with ATMC, you have options. More than 100, actually. You can pick the perfect combination of high-speed internet, digital cable, reliable home phone, and ATMC security with smart home solutions, which means you can get a whole lot of this with more of this, a bit of that, and maybe even some of this and this. The options are yours. So build your bundle today and save with ATMC.